Hi there, welcome to Unit 3, Lecture 2. This is Muscles Part 1. There is an app that you can use to maybe help you learn some things. It's called Visual Anatomy Lite. This is not nearly as good as the bone one, so if you don't want to do it, you don't have to do it. I'm just telling you that it's there. So if you'd like an app, the Visual Anatomy Lite is one that you can look at individual muscles. What I really want you to know about this presentation is the location and the action of the muscles that we present. All right, so our task list for this lecture here, firstly, you need to take notes. Then you need to complete the homework that we have at the end of this lecture. And then there's this little activity called the facial muscles activity. After that, you can complete the Unit 3 Quiz 2. All right, you are going to see my face on a few of these slides because we're talking about the facial muscles, and I find it easier to learn them when you can point them out and such. The first thing I want to do, though, is talk about the way that these slides are actually set up. So if you look in the top left-hand corner, you see a blue box. This one, it says muscles of facial expression. What that means is on this slide, we are talking about the muscles of facial expression. Okay, so on this slide, that's what we're talking about. On every slide, you're going to see a little blue box in the corner. It's going to tell you what type of muscle we are talking about. At the bottom left-hand corner, you should see a yellow box down here. It's going to tell you where you can label things and where you can highlight things. I highly encourage you to label and to highlight what you need to know. There are a ton of muscles, and we are not covering all of them, okay? I only want you to really look at the ones that we are taking a look at here. All right, so first off, on this slide, there's a question. All the muscles on this slide have to do with what? Yeah, I told you it's in the top left-hand corner. It has to do with facial expression. So being able to express emotions and be able to move your face around. That's what all of these muscles have to do with. So the muscles of facial expression that we have are the frontalis, the occipitalis, the orbicularis oculi, the orbicularis oris, and the zygomaticus. All right, so we are going to take a look at the first muscle of facial expression. We are going to be taking a look here at A. So here is A outlined in that little red circle. Which muscle do you think A is? Well, it's in the front of your head. This is the frontalis. So this is a frontalis muscle. If you were to take your hand just like this and put it right on your forehead, you are touching the frontalis muscle. So your frontalis right here on your forehead. Also keep in mind, you have your frontalis. This is your frontal bone as well. See, I told you, if you learn those regional terms, you learn bones, it just gathers on top of each other. So that's really nice. I'm actually going to take off my glasses so that I can not see better, obviously, but I can show you the muscles a little easier. Hang on, I gotta get my computer closer to my face now. All right. So I ask you, what action does the frontalis muscle do? The easiest way to figure out what a muscle does is to touch it. So what I want you to do, take your hand, put it right up on your frontalis, and make a whole bunch of facial expressions. I'll give you like 5 seconds. Go ahead and do that. I'm going to make a whole bunch of them myself as well. All right, hopefully you did that and you probably look just as silly as I did, but I promise fun ways of helping you remember things. So hopefully you noticed when you lifted up your eyebrows, your frontalis moved, right? So go ahead and put your hand back on there, lift up your eyebrows. You can feel that frontalis moving. So the frontalis, what it does is it helps you raise your eyebrows just like that. She's so cute, that cute little girl raising up her eyebrows. So it helps you elevate and depress your eyebrows, and it also helps you furrow your brows. So if you see this here, this nice little line that I got going on right there, yep, that is because the frontalis muscle is so good at its job. All right, the next muscle of facial expression that we are looking at is going to be B right here. So what muscle of facial expression is B? Well, it's right around your eye. So if you look right around your eye here and you think of a word that sounds like eye, looking down, we are looking at our orbicularis oculi. So oculi should make you think of your eyes, right? Ocular should make you think of your eyes, like binoculars are for 2 eyes, okay? So oculi is eyes, and orbicularis is essentially a circle. So your orbicularis oculi are circles around your eyes, okay? So that's what we're looking at here. What action do our orbicularis oculi muscles do? So I want you to take your two fingers, put them on your orbicularis oculi, and do all sorts of facial expression movements. So go ahead and do that. I'll give you about 5 seconds. All right, so if you put your fingers up here and you did all sorts of movements, you probably noticed a couple of things. One of the things is you move your eyes around, just your eyes. Your orbicularis oculi does not move. So your orbicularis oculi does not help move your actual eyeball. However, if you put your fingers there and you blink or you squint, that orbicularis oculi definitely moves. So the action that your orbicularis oculi muscles are going to allow for is for you to blink and close your eyes like that adorable cat that is on the page. So you can blink and close your eyes shut. And it also lets you squint, just like Oprah, who is clearly not as impressed with that cat as I am. All right, we are on to the next muscle of facial expression. So now we are looking at C right here. So what muscle of facial expression is C? All right, so you should kind of notice, remember how we have this circle around our eye? We also have a circle around our mouth. So we know that circle would be orbicularis, and oris, it pertains to your mouth. So oral means mouth, so you can probably remember that. Oral means mouth, and oris is just a form of oral, okay? So orbicularis oris is that circle that's around our mouth, okay? So again, let's go ahead and try to figure out what this muscle does. Take two fingers, put them on your orbicularis oris muscle, and go ahead and see what it does. All right, hopefully while you were doing that, you noticed that when you move your mouth around, your orbicularis oris is doing a job. Mostly your orbicularis oris is going to help you pucker your lips. And what I mean by pucker, if you take your two fingers and you, like, I think it used to be like, people would do that in selfies all the time, like, so it allows you to pucker. So really what this muscle is typically called is the kissing muscle, because typically you pucker your lips when you kiss. So if you look over here to the right, or not the right, to the left, over there to the left, that lady is puckering her lips using the orbicularis oris. And there's the band kissed, because I didn't want to put two people kissing on here because that would be super awkward. All right, we are on to muscle D here. Take a guess as to what muscle D is. So if you look at muscle D, it's right around in here, and that is right on your cheekbones. So those are your cheekbones. If you remember, your cheekbones are called your zygomatic bones. So the muscles that are atop your cheekbones are going to be the zygomaticus muscles. So these are your zygomaticus muscles. So go ahead and take your fingers, put them on the zygomaticus muscles, and do some actions. All right, so hopefully you noticed when you put your fingers here and you smiled, they pulled. All right, so when you put your hand, they pull to help you smile. So your zygomaticus muscles are going to pull to help you smile. That's what they do. All right, we are temporarily skipping E, and we're going to be taking a look at F here. So here's F. What muscle of facial expression would F be? Oh, it's in the back of your head. The back of your head area is called the occipital region. Plus we have that occipital bone back there. Therefore, the muscle is going to be the occipitalis, right? Hopefully that makes perfect sense as to why it would be there. So let's go ahead and try this out. Put your hand on the back of your head and move it around. All right, so sometimes people can't feel this one. Just make sure you have a solid feel on it. When you actually lift up your eyebrows, your occipitalis moves. I promise, I swear. Okay, so your occipitalis moves when you lift up your eyebrows. So seeing this here, the little girl again, right, lifting up her eyebrows. It also helps move the entire scalp as well. So the whole scalp can move because of that occipitalis. So thinking back, what other muscle has a similar action to this? Yep, that frontalis does. All right, so E is technically not a muscle. It actually runs right about in here. It's called the epicranius aponeurosis. Essentially, it's just a sheet of fibrous tissue. It attaches two muscles together. So what two muscles are attached because of this epicranial aponeurosis? Yeah, so your frontalis and your occipitalis are actually put together because of this epicranius aponeurosis. All right, next ones that we're going to be looking at are the muscles of mastication. So I ask you, you can grab something to eat or chew on a piece of gum or do something or just pretend to chew. You can do that as well. What I want you to do is take your fingers and put them on your temples, okay? So your temples, and pretend to chew. Did your temples move when you chewed? Yeah, they do. Your temples move when you chew. Guys, if you've ever been to a fancy restaurant or something and you like look across the room and you see like that guy that has like his temples are showing really well and you can see him like bulge out with every bite, that's because his temporalis is moving. Okay, so his temporalis is moving to help him chew. So thinking about the mandible and what movement is happening with the mandible as you chew, what does our temporalis allow our mandible to do? Well, it helps us chew, which means that it helps it go up and down. Up and down, it means elevation and depression. All right, still on muscles of mastication here. So what does mastication mean? Get your minds out of the gutter. It doesn't mean anything dirty at all. So mastication is just doing this. It's chewing. So mastication means chewing. So when you masticate, you chew. So if you know that mastication means chewing, then the masseter would do just that. So the masseter is also going to help you chew because mastication and masseter, right? It's going to do that job for us. So what movement does a masseter allow us to do with the mandible? Yeah, the same thing the temporalis does, right? Elevate and depress that mandible. All right, we are on to a muscle of head movement. So we're going to take a look at the sternocleidomastoid muscle. Okay, so thinking about the sternocleidomastoid muscle, what bones or bone parts will the sternocleidomastoid muscle attach to? Yeah, so looking at the picture here, we can see 3 points of attachment. Here's one right here, which is on the sternum, the manubrium specifically of the sternum, and then cleido because it's attached to the clavicle, and then mastoid because it's attached to that mastoid process of our I was going to call it our temporalis bone, but it's our temporal bone, right? That mastoid process right here. So our sternocleidomastoid is attached to 3 parts: the sternum at the manubrium, the clavicle, and the mastoid process of our temporal bone. So what I want you to do is place your hand here. If you turn your head, you can feel your sternocleidomastoid muscle right here. And what I want you to do is make some movements with your head and tell me what movements cause that sternocleidomastoid to move. Yeah, so if you look at it, it helps you do one of these. Helps you kind of move your head back and forth. Helps you kind of rotate your head. You can feel it moving when you rotate. This little dot gets shown as a perfect example. Like doot, doot, doot. That definitely makes your head move. So it's definitely allowing for movement and rotation of your head. All right, we are on another muscle of head movement. This time we are on the posterior side of our body. So we're talking about the trapezius. The trapezius is a T-shaped muscle. It covers quite a bit of your back. You can see it on this model here. This is a definite T shape. Oh boy, right there. So that trapezius has that shape to it. Notice that your trapezius attaches to your occipital bone right here. What part of the occipital bone is the trapezius attaching to? Well, it's attaching to the occipital bone, so it's the occipital External occipital protuberance, right? So we talked about that bone structure. That external occipital protuberance is actually what the trapezius is going to attach to. So thinking about your trapezius, you can actually put your hand on the back of your head and do some movements and see what happens. So what movements does the trapezius allow for? Well, if you put your hand back there and you actually tilt your head up like you're looking towards the stars, your trapezius is going to allow you to do that. So it's going to allow you to look up and down, and it's also going to help you do one of these little shrugs, right? So it's going to help you look up and down, and it's going to help you shrug your shoulders. So you can think of your trapezius as the one that's going to help you do one of, these little shrugging of your shoulders and also looking up at the stars. All right, here is a quiz yourself. These are really good for the practicals. Go ahead and do that. The answers are on the slide. This is another thing that you guys can do to kind of help you understand what's going on. So you can actually type in the muscle name and then what type of movements occur because of that and any specific movement that occurs. We are now on to muscles that move the trunk of our body. So we're talking about basically the upper portion of our body here. Looking at the picture there to the right, what muscles do we find on the deep posterior portion of our back? So deep means the most deep. On the back side of our body, we find the erector spinae muscles. So thinking about the erector spinae muscles and where we actually find them in the body, do you think that these muscles are proximal or distal to the spine? Well, it literally says spinae in the name, so it's definitely close. So these are going to be proximal to the spine. So remember, proximal means close, distal means further away. So thinking about an erector spinae, thinking about what erector means and what erect means, what will this group of muscles do for the body? Well, they're going to make you sit up straight. So it's going to help you with posture. So this group of muscles helps you with posture because erector spinae literally means a straight back. All right, so a straight back. So if you would like to label in color, go ahead and do that. That would be available on page 214 of your workbook. All right, we are still moving the trunk here. This is a big muscle. We've talked about this muscle in the past. So on the deep anterior side of the thorax region, we find what muscle? Yeah, we find the diaphragm, right? So we find the diaphragm. Remember, it separates those two cavities, right? Hopefully that is something that kind of rings a bell. So we find the diaphragm. What does your diaphragm help you do? I'll give you a little hint. It's with this picture. And so it's helping you breathe. Your diaphragm helps you breathe, okay? Without your diaphragm, you would not be able to breathe. We'll talk about that more in the respiratory system. So it's going to help you breathe, okay? So go ahead and highlight the diaphragm on page 224 to kind of move us forward. So we're continuing to look at muscles that move the trunk of your body. So do you remember the intercostal spaces when we discussed bones? I mean, I'm hoping that that's a resounding yes. So intercostal spaces means in between the rib spaces, right? So in between the rib spaces. So if you look over there to the left, you can see that there are some muscles that actually sit in those intercostal spaces. So what muscles sit in those intercostal spaces? Good. We have intercostal muscles. All right, so we have intercostal muscles that sit in the intercostal spaces, which makes sense. Now, notice that we have an interior intercostal muscle here. If we have an internal intercostal muscle, we also will have an external intercostal muscle, which we'll talk about on the next slide. So your intercostal muscles are going to help you do this. Yeah, they're going to help you breathe. So along with the diaphragm, your interior intercostal muscles and your external intercostal muscles are going to help you breathe. Notice that your interior intercostal muscles run on a slight angle. This is different than the other type of intercostal muscles. I'm not really going to ask you about which way things run. It's just important for you to know that they kind of run in a way that if you were to tear one, the other one would be okay. So here are the next intercostal muscles. Here are the external intercostal muscles. So are the external intercostal muscles deep or superficial to the internal intercostal muscles? Well, they're more external, therefore they're going to be more superficial. So they are more superficial. What are those external intercostal muscles going to help us with? Yep, they're going to help us breathe, right? We just talked about that on the other slide. So your intercostal muscles and your diaphragm are really going to help you breathe. Notice that we have these fibers that are running straight up and down. Again, this is just to kind of show that you have muscle fibers running different ways so that if you hurt one, the other one would be okay. All right, onward to some more muscles here. We have some layers to the muscles that are in our trunk. Okay, so think about like your belly region. That's what we're talking about here. So looking at the deepest layer is A. So A is our deepest layer that is in our trunk. Okay, so the deepest layer. So it could be one of the following. It could be the external oblique, the internal oblique, the rectus abdominis, or the transverse abdominis. What do you think A is? All right, so hopefully when you look at A, it reminds you of a certain type of cut. So if you remember a section, it was called the transverse section. So this is the transverse abdominis. The reason why this is called the transverse abdominis is because it's just like a transverse section or a transverse cut, right? So if you were to cut something transversely, it would run on the same plane that this muscle runs, okay? So you have your transverse abdominis in the deepest layer of your trunk. Like I said before, muscles are layered in our trunk. Remember, on our most deep layer of our trunk, we found the transverse abdominis. We are now laying these muscles on top of that transverse abdominis. So we have both A and B on top of that transverse abdominis. What do you think A is? So A is considered your abs. Your abs are considered the rectus abdominis. So A is our rectus abdominis. Rectus means straight. Abdominis, you can think abs. So we have straight muscles that run up and down that form our abs. So if you ever think of a six-pack, your rectus abdominis is what can get you to that six-pack like level. What do you think B is? Well, hopefully you thought internal oblique. The reason why it's internal oblique means it runs kind of off to the side. And you can kind of see that these fibers run off to the side. They run obliquely. And they're internal obliques because they're just below the external obliques. What I really want you to remember, your internal obliques are on the intermediate layer. So internal and intermediate layer. Okay, that's where we find those. All right, now we are on to the most superficial layer of our trunk. It is A, this A one here. So which one is left? What is A? Good. A is going to be our external oblique. Just like our internal obliques, they run obliquely. They run on a slight curve, not curve, but like a line that is tilted in some way. Okay, so external oblique. This makes sense that this is the most superficial layer of trunk muscle because it says external, right? So if it's external, it is more superficial. All right, this is a slide full of statements. What I would like for you to do is pause this video, go ahead and fill in the answers here, and then I will go over them in about 10 seconds. Alrighty, so the blank muscles are important for helping us to keep posture. Those are going to be those erector spinae muscles, right? Erector means straight, spine, so we're straightening out the spine, so we're getting us good posture. The muscles that help with breathing, major one is going to be our diaphragm. Then we're going to have our external and our internal intercostal muscles. The external obliques are found on the most superficial level of muscle on the thorax. On the intermediate layer, we are going to find the internal obliques as well as those rectus abdominis muscles, right? So the internal oblique and our rectus abdominis. The rectus abdominis muscles are traditionally thought of as those ab muscles. So rectus abdominis will give you, that six-pack. And the fibers of our transverse abdominis run transversely. That's why they're called the transverse abdominis. Another way to kind of help you remember the rectus abdominis is kind of like your six-pack is, when you want to get good abs, you have to get wrecked at the gym. All right, moving on. Now we are up at the shoulder. We're looking at the deep posterior shoulder. So we're looking at the back and we're looking the furthest in. We have A, B, C, and D, and we're just looking at A and B. Your choices are under what it says, which muscle is which. So go ahead and think about A and think about B. Which muscle is A? Well, it is above the spine of the scapula. And therefore, it is our supraspinatus, because supra means above, spinatus sounds like spine, so this is above the spine. So that is why it is called the supraspinatus. What about B? Well, this one is below the spine of the scapula, so this is going to be the infraspinatus, because infra means below, spinatus means the spine. All right, so as a review, we already know A and B. A is going to be our supraspinatus, B is going to be our infraspinatus, and we have C and D. I'm just going to let you know that C is a teres minor. There's no real easy way to remember that. That's just what it is. And D is going to be our latissimus dorsi. So dorsi means back. Latissimus should make you think of like latitude running. So this is a muscle that we find on the back of our body. So if you take your hand and you put it, think about where your rectus abdominis is, but in the back, so on your back. So you go ahead and place your hand there. You might think that your latissimus dorsi moves your trunk, but it doesn't. So if you twist your body around with your latissimus dorsi, it doesn't actually move. When your latissimus dorsi moves is when you move your shoulder. So what you need to do is put a hand on that area and then move your shoulder up and down, and you will feel that latissimus dorsi working. So it actually does move your shoulder, which is interesting. Sometimes I will call this latissimus dorsi. That is not correct. It is the latissimus dorsi. So if you hear me call it the latissimus, I apologize. It's definitely not that. We didn't mention one muscle here, and it is actually our subscapularis. We didn't mention it because it's on the back of the scapula. It's actually very difficult to see, and that's why I didn't actually mention that. So I have circled all of the muscles that are part of the rotator cuff. So what are, or how many muscles are part of the rotator cuff? Good. We have 4 muscles that are part of our rotator cuff. Their names: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. You want to remember that they belong to the rotator cuff. I remember this because if anyone has ever had like rotator cuff surgery, I don't know if you've ever heard about that, they have to sit after they do it. So I know that sounds strange, but sit, because supraspinatus, infraspinatus, teres minor, and the subscapularis. So if you hurt your rotator cuff, you have to sit. All right, so that's what I remember that by. Also, sometimes people forget that it's the teres minor and not the teres major. So another way to help you remember this is if someone were to hurt their rotator cuff and they were playing baseball, they would end up in the minors instead of the majors. All right, here is a quiz yourself slide, just to help you remember some things. Continuing to look at muscles that move the shoulder, we are now on the anterior side of the body. So we're looking at anterior and more superficial. So thinking back, what part of the humerus does the deltoid attach to? Hopefully you remember that that was the deltoid tuberosity, right? There was that little bump that was on the humerus that our deltoid is going to attach to, and that is the deltoid tuberosity. Thinking about the name biceps brachii, how many heads would the biceps brachii have? Well, bi means two. So we actually have two heads to the biceps brachii, which means essentially that it attaches on two parts of a bone. Looking here, what muscle would be considered your pecs? Yeah, your pecs are going to be your pectoralis major muscle. So your pectoralis major muscle are those pec muscles that people are always working on at the gym. All of these muscles help to move the shoulder. Right now, we're looking at muscles that move the forearm at the elbow. So think of extension. All right, so think of extension of the elbow here. Are the triceps brachii found on the anterior or posterior portion of the upper arm? Well, we know that we're looking at the back because we can see things like the latissimus dorsi. We can see the infraspinatus and the supraspinatus. So we're on the posterior part of the body. So our triceps are on the posterior part. How many heads would we find on the triceps brachii? Well, tri means three, so we're going to find three heads on that triceps brachii. What movement does our triceps brachii allow for? Good. It's going to allow us to extend the forearm. So you can see that lady, she is extending her forearm, which is actually exercising that triceps brachii. All right, now we are looking at the brachioradialis. So looking at the anterior forearm, we see the brachioradialis. Why would this muscle be called the brachioradialis? So I have on here, think back to what brachial means and think where you would find the radius. Brachial means upper arm, and then the radius is on that thumb side. Your brachioradialis runs from your upper arm down to your radius. So that is why we call it the brachioradialis. It helps move the forearm at the elbow. All right, so now to muscles that move the hip. We're looking at the anterior side deepest layers. Okay, so that's what we're looking at. We're looking essentially at your front thigh. All right, your front thigh is what we're looking at, and we're at the deepest layers right now. Okay, so we're looking at the adductor muscles. So if you remember what adduction means, so what type of movement would the adductor muscles allow for? Yeah, it would allow for adduction, which means bringing things closer to your body, right? So think about like little kids when they have to pee, they like push their legs together and they're adducting. They're really using their adductor muscles. We have three different adductor muscles. We have the adductor brevis, the adductor longus, and the adductor magnus. The reason why they're named that way is just the size of the muscle. So the adductor brevis is smaller, the adductor longus is longer, and the adductor magnus is the big one. All right, so brevis is going to be the most superior. Then we have the adductor magnus being the most inferior. I always remember this just because it's alphabetical, right? Brevis comes before longus, and longus comes before magnus. So we can remember that alphabetically it would go brevis, longus, and then magnus. My husband sometimes likes to help out and tell people his ways of remembering things. And he remembered it as hip balm because on your hip you have the brevis, the longus, and the magnus. So whatever works, use it. Tell me what actually works for you. So now we're going more superficially. So underneath, so on top of those adductors. So now we're on top of the adductors. So as we go more superficial, we find the iliopsoas muscle. Essentially, it's a large muscle composed of three other small ones. Looking at the iliopsoas, what part of the pelvis is it connected to? Good. It's connected to that iliac crest. So we can see that it's connected to the iliac crest, and it's going to help move the hip. So now we're looking on the back side of our body. We're looking at the butt region here. So what muscle is found most superficially in the gluteal region of the body? Yeah, we find the gluteus maximus here. So the gluteus maximus is the most superficial gluteal region muscle of the body. Usually students don't have any trouble remembering this one, so we're just going to go ahead and move on. I put a little pirate with their booty down here so you can remember that the gluteus maximus is your booty. Now we're looking at muscles that move the lower leg at the knee. So think of like flexion and extension of your knee here. So we're looking at the sartorius muscle first. So when you look at the sartorius muscle, it kind of looks like a strap. So that's kind of how I remember it. It's a strap right across your femur. So your sartorius muscle is used when you sit crossed like legs. So think of like going to camp, they made you sit like crisscross applesauce, right? So cross-legged. It was named sartorius because tailors used to sit cross-legged to do their work. So that's why it was called that. It means tailor, sartorius, they used to sit cross-legged. We also have the rectus femoris. Remember, rectus means straight, and femoris should sound familiar. So what bone would the rectus femoris follow? Yeah, it's going to follow the femur, right? Femoris and femur. That is why it's named that way. It's the straight muscle that runs down the femur. Now we have A, B, and C over there to the right. What muscle do you think A is? Well, it's on the lateral side of the body, so that is going to be our vastus lateralis. What would B be? Good, that is going to be our vastus medialis because it's on the medial side of your body, which leaves C to be our patellar tendon. Okay, so our patellar tendon, which is going to run from your patella down towards your tibia. We also have a muscle called the vastus intermedius. Okay, so we have a vastus lateralis, a vastus medialis, and we have a vastus intermedius. Where are we going to find the vastus intermedius? Yeah, it's going to be right in between our vastus lateralis and our vastus medialis, and it's actually going to be underneath the rectus femoris. So if we peel back the rectus femoris, underneath that we would find the vastus intermedius. All right, so the vastus lateralis, vastus intermedius, vastus medialis, and the rectus femoris are all on your thigh. They're on your upper thigh. What do we typically call the muscles that are on your upper thigh? Yeah, they're your quads, your quadriceps. Look at those on those people. Dang, mine don't look like that. So they are your quads. They're normally called your quadriceps. They're called your quadriceps because there are 4 muscles that are part of that muscle group. All right, now we are looking at muscles that move the lower leg at the knee. We have the biceps femoris, the semimembranosus, and the semitendinosus. On the back of your leg, so we have the quads in the front. What do we typically call the muscles that are on the back of the leg? Yeah, we typically call these the hamstrings, right? So these are typically the hamstrings. So I use that to help you remember these back of the leg muscles are your hamstrings, because if you ever eat a ham, it can be semimembranosus, because you know how ham can have those like membranes that's on the top of it that you have to cut through. And you want your ham to be tender, so it should be semitendinosus, right? Right. And then biceps femoris because bacon is a type of ham. So bacon and biceps femoris. You can also remember biceps femoris because it's the back of the femur, right? Back femur. Biceps femoris is on the back of the femur. So those hamstring muscles, your biceps femoris, your semimembranosus, and your semitendinosus. So they, again, help extend and flex the knee. So now we're looking at muscles that move the foot at the ankle. We have the gastrocnemius. Can't say latissimus, but I can say gastrocnemius. We have the soleus. We have the tibialis anterior, and we have the calcaneal tendon. So what is the more common name for the gastrocnemius? Yeah, we typically call that your calf muscle, right? So your calf muscle is your gastrocnemius, which is nice, right? Because calves produce a lot of gas, so therefore calves are gastrocnemius, maybe? All right, so looking at the soleus over there to the right, the soleus is just deep to what muscle? Good, it's just deep to the gastrocnemius. Because once you get past the gas, you find the soul of someone. It's true of my husband, right? So so it's just deep underneath the gastrocnemius, you find the soleus. And what do you think that calcaneal tendon is going to attach to? Good, it's going to attach to the calcaneus, right? That heel bone that we have. Then we have the tibialis anterior. It's named perfectly because where do we find it? Yeah, it's on the front of the tibia. It's on the anterior of the tibia. Therefore, it is going to be found, it's going to be called the tibialis anterior. Think of your tibialis anterior as your shin. Okay, so you think of your shin. If you've ever gotten shin splints, it's usually because of that tibialis anterior is pretty sore. So this is just a slide to help you organize your muscles, so you can do that to kind of help you. And we made it to the end. So you have some homework from this lecture. Only label things that we talked about. You don't need to label things that we did not talk about. Okay, so only label the things that we talked about. There is a facial muscle activity that you can do to help you understand what's going on. And then your related quiz is a Unit 3 quiz 2.